is Dr. Khan, Executive Plastic Surgery. So, very interesting case today. This is a 52-year-old female status post gel implants, according to what the patient said. Gel implants, that's the silicone implants in 1997. She had an MRI done which showed both of them were ruptured. And so when I examined her yesterday, there was actually a mass that was protruding out from the left breast and the right breast. You really couldn't feel the implant. Now what's interesting is as I went in, you will see complete end block 12623 initials MS. And what I want to show you, I cut out the excess skin for the contouring, and as you will see right here, this is what I removed. And look at the way this has collapsed. It's like triangular, if you will, and it's folded up on itself. I go around. Now remember, anytime you remove anything, it has to be done end block. That's the gold standard. And there's a lot of inflammation present. So what it looks like, and on clinical exam yesterday, I told her it looks like she has had saline implants. And remember, back in 97, the silicone implants were banned. And so she could only get saline. So I'm going to go ahead and open this up. And as you will see, look at this relatively thick capsule. And as I go in, very interesting, you will see this is the end block of ruptured saline implant. And this is indeed what is literally collapsed on itself. And I'm going to go ahead and remove this. Now, can I go ahead and get a syringe? So anytime you have fluid around the implant, you have to send this off to pathology. That's the take-home message. So what I'm going to do here is I'm going to take this fluid. We have plenty of it, but we want to send everything off. Remember, this is a sterile field. I've seen some patients do it on a non-sterile field. No, you want to do it on a sterile field so that you have... Now remember, some of it may be the saline. If I can get another syringe, please. I'm going to put it right here. But there's plenty of fluid. Some of it may be the saline. Or you have to rule out the BIALCL. Very interesting. So we've got 2 syringes here. Can I get 3 more syringes, please? So thanks, Nadia. Okay, so as I go in, let's save this in 3. So you want to save everything. That's good. So all that end block, we don't want to cut into this and this fluid leaks into the chest. And God forbid this is BIALCL, because it technically can be. And so even with, so you see how the capsule collapses on itself. Look at this fluid around. Now if I take this fluid that's around and I go like this, you can see it's viscous. It's not clear saline. And this is where that gel bleed is. And look at this crud that's here. Look at this. I'm going to go ahead and send this off with the capsule so that they can see. So look at this implant. It looks like a valve issue. Look at this. This is a faulty valve and a rupture right here. Look at this. She said that, you know, when the left one collapsed, she felt like she got a big heart attack because it completely, just like a flat tire, if you will, deflated. So this is, look, it's ruptured over here too. Look at that. So I'm going to go ahead and use my, it's ruptured here. The valve was an issue, as you saw, right? Right here, and then the third one here. So implants are not meant to be in the body forever, and remember the clinical exam is significant, even though the MRI said ruptured. Now what's interesting is the MRI did not say it was saline or silicone. They were very general about it. Now what I'm going to do is I'm going to go ahead and remove, I got it, the second pair of gloves that I have so I don't cross-contaminate. And I'm going to go over to this left side with the L left side. And look at this. Very thick tissue, abnormal. If I touch this, this does not feel normal. Over here too, a lot of inflammation. This patient was hurting. What's interesting is her best friend sent her to me, and I did her surgery as well. Nice lady. So as I go in, look at this. So we have some fluid. So what I'm going to do is I'm actually going to go in. I'm going to cut a little bit more so I can see better. All done end block. If you don't do the end block, guess what? This fluid is going to go to the chest, and guess what? The whole purpose of the end block is lost. And that's even with saline implants, you have to always assume that the implants are ruptured. And look, it's very thick and yellowy. Just look at that. It's yellow, thick, viscous. Now I'll tell you, this is a big red flag for a BIALCL. So anytime you have fluid around, it's very thick. I'm just going to go ahead and take this and I'm going to drop it. You can see how it's like honey, like molten honey. You see, it says that. So very interesting. And this lady was poisoned by these supposedly saline implants. What a shame that they did not ban the saline implants, because this is in 1997. You could get only saline implants, and these were supposed to be the safer ones. I'll tell you, saline implants are as bad as silicone implants, if not worse, because they give you the illusion that these are safe. Look at the viscosity of this. Thank you very much. Look at the viscosity of this. So what I'm going to do is I'm just going to gravity dependent area. I'm going to get some more fluid out. We have to send everything off. And look at that. It just keeps coming. One more. So this is very thick fluid. Very viscous. And I'm going to go ahead and... Implants are not safe. Be it saline and silicone. And so as you will see, look at this. I want to show you once again. If I go in, it's thick. It's not saline. And look, this was much larger on this side than that side. Natalie, one more. Sorry. We're gonna put you to work today. All right. I want to take everything, every drop of fluid. You don't want it to spill. Thank you very much. Hopefully this is the last one. So again, I want to show you how thick this is on the inside. So I'm going to put it here. Alright, so let's go ahead and look at the inside of this. Let me just see. That's good. Look at this. Now remember, some of this is saline, but look, it's thick and viscous. Much more so. And look, the capsule over here is much thicker. See the capsule. I'm going to invert it out. Look at it has this consistency. Remember, all that end block Much thicker capsule. And see the inflammation right here around, that has to go. I'm going to cut this open just to be complete. Now you cannot tell grossly that if it is cancer or not cancer. The pathologist has to dissect. So we'll send this off separate and let's look at this one over here. Look at the color, look at that white plaques on the inside and around. Look, here's a rupture. And collapsed. Let's see over here. This is your 425, by the way, 425cc implant. Take home message, saline implants are not safe. Look at the ruptured implant that she has both right and left. On clinical exam, I could actually feel a mass. That was the ruptured implant. That was the triangular fragment sticking out. She was in a lot of hurt and misery. So the implants will be returned to the patient. The capsules will be sent to pathology, rule out the BIA, ALCL, CD30 analysis, rule out lymphoma, rule out malignancy. The specimen, the fluid on the right will be sent separately to cytology, rule out the BIA, ALCL, CD30 analysis, rule out lymphoma, rule out malignancy again. Left fluid to cytology. Cultures have been done for aerobic, anaerobic, and fungal. And remember, the en bloc, gold standard, no other better way. You don't want this fluid to spill into the chest, this viscous fluid. There's definitely a very high concentration of silica/poison and heavy metals and whatnot else that has disintegrated and incubating in the patient for years and decades, literally. And so there you have it. The con procedure, number 1, twilight sedation. Number 2, no lift done. At this case, as you can see, the inflammation. Number 3, no need for drains. I felt very happy and comfortable with how the whole dissection went. Number 4, the culture sent to microbiology. Number 5, the capsule sent to pathology, rule out the BIL-CL CD30 analysis. Next, liquid that is sent to cytology, rule out the BIL-CL CD30 analysis. And then pictures of the chest and the videos showing complete removal of the capsule, and in this case certainly opening up. Remember, that's anyone can remove implants, but it's all about doing it in that en bloc fashion such that none of this fluid spills into the chest. And every patient, regardless of age or comorbidities, has to get the surgery done in the same fashion. A week ago, I did a nice lady, 71-year-old, with bilateral cardiac stents and subclavian stent COPD, but she was done at the hospital. And every patient gets a rigorous pre-op workup and checklist so that when they do get the surgery, there's no surprises. So there you have it. This is Dr. Khan, Executive Plastic Surgery. Please share.